Blobcast. Free the period.
My name is Kath, and I started my period the day after my 10th birthday.
My name's Heidi, and I first got my period at 15 years old.
My name is Emma. I am 10 and a half years old, and I started my period 5 months ago.
Helo, fy enw yw Angharad a fe ddechreuais i'r misglwyf pan ro'n i'n 12 mlwydd oed. My name is Angharad and I started my period when I was 12 years old.
My name is Rebecca and I started my period when I was 11 years old.
My name is Leah and I had my first period when I was 10 and a half.
Hello and welcome to the Blobcast. Here at the Blobcast, we want to free the period. What does that mean? It means periods shouldn't cost us money. How do we even begin to achieve this? We think open conversations about periods are the start. Shame and stigma around bleeding and menstruation has ruled for too long. My name is Casey Robinson. I'm a period educator, and that means I go into schools and workplaces to talk about all things periods. I'm also a diversity and inclusion educator. In this limited series of the Blobcast, we'll be talking to some of my favourite activists, commentators and charities that work in this area. The one thing we all share is a passion for periods, a passion for open conversations. Many of you will have heard the term period poverty. We're not going to use that phrase here because research shows that people in that situation feel uncomfortable with it. We're going to use the phrase period equality, which is more than affordability. It's about awareness, understanding, and again, back to those open conversations. Today's episode is a pain. And many of us will have experienced that with our periods. We want to find out what pain, if any, is normal. What kind of pain are we experiencing? What can be done about it? And why do periods even cause us pain in the first place? Helping answer some of those questions is Dr. Annabel Sowemimo from Reproductive Justice, formerly Decolonizing Contraception. She works at a gynae outpatient in community sexual and reproductive health and at a menopause clinic. She is also studying for a PhD in how Black British women access contraception and abortion. Wow, what a CV. We've also got the one and only Chante Joseph. She is the author of British Black Power, a broadcaster. She presents The Guardian's pop culture podcast, a content creator, and a recent sufferer of period pain. Welcome to the Blobcast. PHS. We do more. We're here to talk about pain, right? Pain and periods, which for me is something that I guess personally I don't relate that much to. But I say that because my understanding of like pain and periods has developed over time. So like the first time you ever heard about having a period, the idea was like it was going to be painful and it was going to be really crap and you're going to have the worst time. So I think in some ways my like mind was setting itself up for it. But the older I've got, the more I've learned about periods, the more I talk about periods, actually like I realize I'm probably a lot lower down that spectrum that I thought I was in terms of experiencing pain, having friends that are living with endometriosis and PCOS, like people's going through some things that I maybe thought I was going through, but I'm not. So I wanted to come with a couple of facts, and then I don't know if you feel free to like comment on them and we can reflect on what we feel about the facts. One of the things that came out fairly recently was a professor from reproductive health at University College London revealed in 2018 that research shows that pain can be as bad as having a heart attack. Annabel, what does that speak to you? Does that feel like something that you feel is a good thing to share with people? Is that something that's really giving voice to like a lot of people's experiences?
So I think it's really important that we have more data around menstrual pain, right? And that kind of research is important for illustrating the severity that it can potentially be for some people. And historically it's been downplayed. So I do think that data is really important. I think there was more research within the last year or two. I can't cite the person, but essentially said that moderate period pains is the equivalent of the early phases of labour, right?
Right.
And people recognise that childbirth is difficult, right? So
who knew?
You know,
who knew, right?
And it gets downplayed. So you're supposed to go to work, do your exams, just carry on like nothing's happened to you. And as somebody that does experience bad menstrual pains, you know, I've had to go home from work. Even recently, I think that this information is important for people that don't experience period pain to have some comprehension, because you're often gaslit, almost like you should be able to power through it. You're not resilient enough. And we need to understand that we are resilient. We're not just making it up. We are actually in pain. So I do think these stats, these figures are really, really important. Ultimately, it motivates people to do more research, right? When they hear those data, we want to understand why, we want to understand how we can improve it. Because pain is relative and we all have different pain thresholds, what is painful to some people might not be painful to others. And it's something that's important to understand. So some people you shouldn't tell people that, whereas in their minds it's going to make them amplify it and then suddenly they're in more pain, right? Although that might be true for some people, I think it really does actually help, as I said, the healing process for other people to understand that actually their pain is very real.
Yeah.
And what is happening to them is very, very important.
I don't know if it's a myth, but that key idea that's people, women especially, are so incapacitated during their period, they're just useless, they can't handle it. But then also on the flip side, just get on with it, right? The way that those two things somehow sit together despite being complete opposing things. So I think, your point around knowing more is also really helpful to dismiss loads of those really harmful and gaslighty type myths. So,
and just to bring in some personal context as well as my medical context, I, as I mentioned, have really bad menstrual pains, and I didn't have any kind of preparation around what my period would kind of be like from a pain perspective. And I guess your mum, whoever raises you, doesn't necessarily know because each person's an individual, right?
Yeah.
My period started quite late, so maybe about 14. And for ages, I hear from a lot of my patients, I thought the fact that I had loose bowels and, doubled over was actually just everybody's experience.
Yeah.
It took me until kind of my early 20s to understand that that wasn't what everybody was experiencing when it came to the first few days of their period. So we do need to prepare people for the spectrum, because most of us just wandering around for ages thinking this is what's up for everyone.
Yeah.
And I remember taking my GCSEs on one of those days, and I think back and I was like, no, should definitely have been able to have some help around that, at that time.
Definitely. Chante, do you want to lean in? Anything that's coming up?
Yeah, I think it's a really interesting one, because when I think a lot about period adverts and campaigns, it's always I can, be an Olympic athlete and still, be on my period because I have Tampax or Always or whatever. And I really sometimes hate those narratives, because I think they also do feed into this idea that don't let your period ever stop you from doing anything. But actually it's there's a real conversation to be had about pain and people who can't do things. And I definitely think it does promote that message that people who feel completely unable to do their daily tasks because of their period are kind of choosing to do so. Because look at this, person skiing down a mountain slope as part of the Winter Olympics, and they're on their period as well. And I think, that narrative doesn't just exist, I guess, amongst us and in the workplace. It's what's kind of presented in the media, particularly amongst different period brands. So I 100% agree that sometimes this information is extremely useful, because it does give context and it does make you feel less bad about, if you do have a period and you're you can't do anything. I think growing up, from my own personal experiences, I've never really had really bad periods. And so maybe I have 1 or 2 days that are bad, but I can still kind of go about my day and function. But I've never really felt this has stopped me from kind of doing things, or it's been unbearable, or it's something that I've been I'm really worried about this. So I think, I'm kind of in the same boat as you, in that the pain thing hasn't really been too much of a huge issue. I think it's a bit different now. I think I was saying before that I got the copper coil, the 10-year one, and that's definitely changed everything about my period, from how regular it is to how long it is to the pain and all that kind of stuff. So I'm now kind of experiencing a new period that is slightly, I wouldn't even say painful, but just more kind of uncomfortable and much longer than usual. And so now I'm having to think so much about my routine and my life and what these days mean for me and what I can and can't do and stuff like that. So that's changed a lot for me as well. Because I think, pain is one thing, but then there's a level of discomfort and how you dress. And do you know what I mean? I think there's so much more that happens around it that you have to maneuver your life around. And obviously pain is one element of all of that.
At the Blobcast, we're all about open conversations. We interviewed people who menstruate to hear about their experiences of pain. Here's what they had to say.
It's kind of it's like being punched in the stomach.
Just had this contraction pain come on deep into my womb, it felt like, where somebody had 2 hands gripping my uterus and just twisting it. as tight as possible.
It's like a dead pain. Do you know if you got punched in the arm and you had a dead arm, but it's like that constantly, but in the bottom of your stomach, to the point where I can't stand up straight. I have to like be hunched over.
Some months I am absolutely debilitated. My legs hurt down to my knees. My back is in like agony, like I've slipped a disc, and my womb feels like it's full of concrete, solid and dragging down. And that's without the cramps when you're passing clots.
For me, I'd say my period pain is worse than the pain I experienced when I was giving birth. The contractions have got nothing on my period pain.
Sometimes my cramps just last like 2 minutes and they'll go, but sometimes they'll last like 10, 15, and it's just like the worst. Like, I've been in shops before where I'm like, give me a minute, I need to sit down for a second, like I can't move.
First day is sort of the only bearable day of the period, and then the second, third and sometimes even fourth day is lots of pain, really tired, sort of floored.
I had to walk home from school and I had to stop walking because I physically couldn't move.
I've sort of always gone super plus with the tampons, bled through many a clothing and ruined many a bedsheet.
It's like a burning heavy feeling, like a cannonball or a bowling ball or something lodged in our pelvis. It's like a weight.
It's not even once a month, really, is it? Because I swear it's like 2 weeks out of every month I have the preemptive pain, the period pain, and then you have some sweet relief before it all starts over again.
The Blobcast. Free the period.
People I know and friends of mine who said they are actually experiencing really bad pain, but have also been like, oh, it's not that bad, because they're so used to it, haven't talked to anyone else about it, assume that's just the norm. So like really understanding kind of that spectrum and recognising that, are we talking about discomfort and like irritability and a bit of an annoyance around that's happening, or like actually a proper health condition and a health concern?
So on that,
Yes, doctor, take it away.
So when we talk about pain, one of the ways, I suppose, of knowing whether pain is a medical issue or something needs to be done about it is exactly the things that Chante was just mentioning, right? That if your life is changing around the fact that you have discomfort, it's now becoming pain, right? So you have to decide that you're not going to do things today. Can you go into work and function the same that you did before when you didn't have this feeling, this pain, right? If you can't, then obviously then you need some help with that, and that is not quite normal because you're having to restructure your life and you can't do the things that you would usually do. And this is not saying, obviously, you know, some people might say some forms of exercise they can't do on their period because it's not practical because they're bleeding. That obviously is a practical thing. Whereas if you are saying, I actually can't concentrate during my job, or I can't lecture, I can't I can't make deliveries, I'm rolling around, then obviously that is a medical problem and it shouldn't be so severe that it's dominating your life.
Right.
I think sometimes we're told to minimise those things and that people's thresholds are different, right? So some people can still function even though they have these feelings and other people can't. And it's okay to say that, you know, my pain threshold's not that good. Like what is a dull ache for some people is actually really incapacitating for me.
Yeah.
And I think that's where we need to start being a bit more fair.
Yeah. Compassionate.
Yeah.
So it says here around 80 to 90% of people suffer period pain at some point in their lives. In 5 to 10% of women, the pain is severe enough to disrupt their lives, right? So this is data from various sources, with most of these women complaining that period pain starts. I don't like that word complaining, by the way. Let's just say mentioning. That feels really gendered and gross. Most of these women saying that period pain starts in their teens or early 20s. So like the idea that we'll all maybe at some point experience that like end a bit of like spectrum of pain, but then sort of a smaller percentage being around like really something that interrupts their lives. And that sticks out for me, particularly like in the workshops with young people, and particularly young people like understanding their periods for the first time, whether like they've just started or they're about to start or some of their friends, whatever. There's this like anxiety that young people have where they want you to tell them that like your period's exactly going to be like this, right? They're sometimes a little bit blown away by the idea that their period can be a bit different. So I'll always like share stories in, well, when I was 22 it was kind of like this. Like, it just opens up into a new bit. Like, if you start talking about products, that then leads to another conversation about XYZ, then leads to about pain, then leads to this. Like, there is really so much to discuss. And I think like, in those, talking to young people, like, as soon as you tell them one thing, they're like, oh, and I've got a million questions about 100 other things too. And like you say, we're not really encouraged anywhere just to have the conversation because it's important and like enjoyable to have, right? Which brings me to another point. So PHS's period equality research found that 82% of learners who missed school because of their period did so as a result of period cramps. But also the idea is like 82% of young people are actually off school because of those period cramps.
It's important as well because I feel like online, particularly like TikTok, has become like such a good place to get this information. Like, you have people who will just like have a like model like vaginas and be like, this is what happens when you do it, and that stuff is so good and so helpful. But then on the other end of the spectrum, there's so much like misinformation as well.
Yeah.
And I think there's a lot of dangers. Like, I don't know if you'll have opinions on this as well. Like, a lot of people being like, you know, try this supplement and this supplement and this supplement. And I have a friend who will buy every single supplement someone on TikTok told her to buy her for like, you know, less painful periods, and she will like take them all and and I'm like, gosh, like I do wonder if like the fact that this is so accessible and just like anyone can just say anything and put it out there, like, and I think that is the problem, and particularly when it comes to pain. And although this isn't particularly periods, I remember before I got my coil, I would, you know, just looking on TikTok to find people's experiences, and it was just like, this is the most painful thing in my life, and
Yeah.
and I hated it, and And so sometimes you get more anxiety by using like online platforms to educate you and inform you about this stuff, because a lot of the time it's people sharing their worst ever experiences. And maybe I'm guilty of it as well, with being like, oh, my moon cup got stuck inside me, I had to remove it. And those people being so scared when I went to get my coil done, and it was just like, fine. And like people will say the same thing about smear tests. Oh my God, it was the worst, But then there's actually, like, for me anyway, like the experience was okay. And then there's so much that you can ask for, you can put in place to help make the experience more comfortable for you. But a lot of people don't even know about that. And people's TikToks and their Instagrams and their stories aren't talking about ways to make it better. It was just like, this was the worst thing that ever happened to me. And so it's sometimes so difficult having conversations about periods or period pain when you're living in an era where like everybody comes online to share their most outrageous stories. And then I think it then makes people feel more anxious than they need to be.
Yeah, the drama around it. And that's the thing is, right, is that I suppose on the side of everything that Instagram, TikTok is good for that, because we are seeing so many more people talk about it, but we are also only seeing the dramatic stories, the ones that get the most likes, the ones that get the most hits. And so when we're talking about that education piece, obviously young people today, maybe compared to us, could go and educate themselves, but there's literally a bombardment of information and you don't know, like, who to trust, what's right, what's not. Like, am I just like a sucker for capitalism here and I'm just buying everything because it's in a nice packet and it looks all aesthetically pleasing? Okay, I want to talk about like diagnosis and the ways in which a lot of the bigger issues with periods, like endometriosis, like PCOS, the average amount of time they say is 7.5 years to get an endometriosis diagnosis, which feels like a massive amount of time.
It is.
Is there an explanation as to why it's that long? Is it like a whole ton of factors that actually I can't give you a short answer and I need an hour to explain this?
I mean, it's a whole ton of factors, some of which we've described, but I think they can be summarised pretty succinctly. One of them we've talked a lot about. It's about how society has told us to feel about our pain. So for a very long period of time, no pun intended, people just power through, right? They're like, this pain that I have, I think it's a bit normal. Wait, oh no, it's not normal. I spoke to somebody, oh, it's not normal. Yeah. So that takes them some time. There's a lot of barriers, particularly in the healthcare system we have at the moment. People are trying to get appointments. They're trying to speak to their GP. The GP doesn't have time, they're overwhelmed. Then they see a different GP, the process starts again. That might take a couple of years. And I say this to the medical professional that also, has to see my own doctor. And I've experienced some of these things. And I think people forget some of us we are all in it together, right? Yeah. We are experiencing the same problems that the public are experiencing. So there's that. And then there's the process of actually diagnosing endometriosis. So with endometriosis, the condition is essentially growth of bits of the womb lining outside the womb, and that bleeds and causes pain in a cyclical fashion, and you can't see that on an ultrasound scan. So you can sometimes see similar changes, especially if you have it in the ovaries, but it's not clear. So kind of the first steps of investigation, people might wait a few months for the ultrasound scan. It's not conclusive. inconclusive. We can give you hormones to see if it helps initially, but to definitively see it, you then have to have what we call as a camera test in the stomach, which is an operation done under general anaesthetic, a laparoscopy. So you then have the wait time for a laparoscopy. A lot of people don't want to have a procedure where they're put to sleep. It's a bit daunting. Also, there's a wait for that. And then that's even a snapshot diagnosis. So somebody goes in with a camera and they will have a thorough look around, but spots of endometriosis might be really small. Very occasionally, those might not be seen, especially it's very early endometriosis. And we know that the staging of endometriosis doesn't necessarily correlate to how significant your pain is.
Okay.
So sometimes stage 1 or 2, where there's dots of endometriosis in the pelvis, people might have really significant amounts of pain from that. The same as somebody that has, stage 4, where the endometriosis is everywhere, there's a lot of scarring. So all of these things make it quite a difficult thing to diagnose, in that we don't have an easy test to conclusively say you have endometriosis. Polycystic ovaries syndrome, PCOS, is usually a triad of things. So you have cysts on the ovaries. The ovaries are a bit bulky because you have large cysts on them. That can give you pelvic pain, cyclical pains. Some people don't have that. They just have irregular period cycles. You can get hair growth from hormone imbalance, increased testosterone, so you have testosterone levels. So it's all of these symptoms. You need kind of 2 or 3 of the symptoms to get a diagnosis of polycystic ovarian syndrome. A lot of people might struggle to get the blood test, again, because of seeing health professionals, get the ultrasound scan. So people might struggle to get all the information they need to conclusively say that's what's going on with you, essentially. Or sometimes with polycystic ovarian syndrome, because you can also struggle with weight gain, and as I said, hair growth, sometimes there's a lot of prejudice that if people don't have what is considered a typical PCOS appearance, people are like, well, you don't have that because you don't fit the mold of PCOS, right? So these are all some of the barriers that people may experience in terms of getting those particular diagnoses. So it's multifactorial, but there are some things that clearly need to change, and a lot of them are system issues around reproductive health, where it's just so much harder to get people to take reproductive health problems seriously.
We are sponsored by PHS. PHS supplies schools with period products which are free for any and all learners who need them, whenever they need them. No questions asked. Talking about pain bias, right?
Cheeky plug.
No, never a cheeky plug. Important.
So there is a chapter in here called We Feel Pain, and it's very much talking about the racial history and race science and pain. So how we have perceived black bodies, indigenous bodies, and I call them bodies because historically that's how, racial capitalism has seen us, just as, labour and not really thinking about our health and needing healthcare, and how that sometimes has fed into the health system that we have and how health professionals can treat people. And it's not just a racial issue, it's also a class issue in terms of sometimes if you speak a certain way, or people think you're more likely to complain or have some social standing if you don't get the service that you want or require, and this is not just health, this is in any situation, you're more likely to get a better standard of care or, service delivery, because people think that if they don't give you care that's up to standard, that it will end badly for them. So these are some of the things that make it more difficult for people to have kind of their pain or poor health conditions taken seriously. There's been a lot more conversations around black women in childbirth recently, because we've also had startling statistics in that regard about black women being 5 times and then 4 times more likely to die in childbirth, and some great organisations like 5 times more doing work specifically around that issue. But some of the things that have been raised around that is that when we say we're in pain, particularly around labour and things like that, the responsiveness isn't really there.
Yeah.
And also we have a level of maybe internalized racism.
Yeah.
And also internalized classism for some people, where they feel like if they speak up and say that I am in pain or I need this thing, then they're going to be seen as angry or fitting that mold of, you know, a shouty black woman or a shouty working class person. So then they don't say, even though that they actually think that they need the help as well.
Yeah.
So it's multifaceted. It's also health professionals not enabling people. It's also people regulating themselves to their detriment because of all these structures around them that make them feel silenced. And often this can lead in a really bad place. So just to give you some cases or some kind of statistics around this, there was some research done in the US, which was retrospective. So they looked at about a million cases of children that had gone into hospitals for appendicitis and looked at the pain relief that they were receiving and looked at it racially. And they found that Black and Hispanic, and I know Hispanic is often treated as a race, but we can unpack that.
We can unpack that on another episode and another podcast.
But were not as likely to be receiving the strongest type of pain relief, so like opioids, like morphine for appendicitis, you know. And there's many reasons why that might be, as I mentioned, being offered it, feeling like they can ask for it. But, you know, these things are quite striking. And I would say that I've had similar experiences because I look quite young, hopefully. I'm in my early 30s now. But often, you know, I've been questioned when I've been going to medical care about, you know, whether I actually need certain things or how I've come to such conclusions. And because people assume that I'm young and I'm not, hey, I'm a doctor, I'm in A&E, I just go like everybody else, right? These are ongoing issues. There's been a long history in campaigns of this country because often people say, oh, that's the US, different system. The UK is different, and it's difficult because people try to gaslight you when it comes to pain because it's not visible. Right?
Yeah.
So people will always say, it's not that bad. You know, you look otherwise quite well. She was playing on her phone. Pain can present differently cross-culturally, right?
Yeah.
So in some cultures, it's not acceptable to be screaming in pain, right? So people have been brought up differently. It's not just a cultural thing. You're supposed to keep your emotions in and quite rigid. And if that's the case, it can be difficult for health professionals that are not from certain backgrounds also to interpret that. And that's a cross-racial thing. People that are brought up in different parts of the world will act differently when they're in pain. And, you know, we need better education around those things.
Basically everything you described, like I definitely feel like whenever I have to go to a GP or I try not to look bummy. I try to like, you know, present in the best way possible. When they talk to me on the phone, I'm like, you know, I do feel like I have to put on this sort of performance to be taken more seriously as a patient. And that's like basically everything you described. Like you go into these medical institutions and you kind of just feel like from the moment I get here, I feel like they're finding excuses for me to be lying or for me to not be telling the truth. And it's really interesting as well. I think like when you think a lot about like the history of the NHS and like black nurses and like how they're still being treated and how they have been treated and just like this long sort of like issue between like black communities and our health system and our health services, from how we operate within it to how we're treated by it. Like there's so much kind of history there and context there that then falls onto like the children of people who've moved to this country, and then we start to notice it and then we start to have these kind of internalized issues as well where we feel like we're going to go into a room and not be believed, or I feel like I have to know all of my facts, or I have to like be extremely clear about what I want, because I think it's very easy to be dissuaded from asking for something you know that you need because you feel like, because there's like an imbalance of like knowledge here, even though I feel quite certain that I need this thing or I want this thing, I'm afraid to really petition for myself. Like, and I think a lot of people probably struggle in those positions as well, because then you feel like, oh, I actually don't know what I'm talking about, so I'm going to believe this like white medical professional over my own sort of like body and knowing what I think is going on here. So I think it's like, yeah, it's really tough, and I think you almost just kind of conform to it and you just let it happen, and you're like, okay, cool, I know exactly what I have to do to be treated in X way, and I'm going to perform that, as opposed to feeling like I want to dismantle it because it feels like it's more than me as an individual. It's like the whole institution.
The Blobcast visited Harlow College in Essex to speak to their students about their experiences with period pain. Here's what they had to say.
I've always struggled with pain with mine, to the point where like I pass out every month. And it's happened when speaking to like older people in my family. It's hereditary, I think, like the pain and the passing out. But in secondary school, they didn't really cater to that very much. It was very much sort of not an excuse when I would come in and I'd feel so ill to the point of either passing out or like gagging in pain. And they wouldn't be interested. Unless I was physically ill, they wouldn't send me home.
On the whole, my periods are pretty, I usually get my period for like 7 days, sometimes 8 if I'm very unlucky. It used to be really hard as well because I used to share a room with my brother, but I would always have to like try and get pads out without him seeing and like going to the bathroom and stuff, so it was really, really hard because his chair that he used to sit in would be like right by my like pad drawer, so I would like go over and just like wait for him to like look away and just like get it and then walk out. But it was really rough, but thankfully now I don't have to deal with that.
Mine are quite light, they're not too bad. They're basically every month at the end of each month, and they're, not too much pain, not much at all.
When I started my first period, it was kind of okay. Like, it was just like what they normally teach you, like 5 days, kind of okay, light to middle flow. That was fine. And then from there, it kind of just progressively got worse every month. The pain kept coming on, and by the time I was around 12, it was like I just couldn't function normally, and I was put on medication for it, which actually made it worse. So I would take 2 tablets a day. This was about 6, 7, 8 month period of time, and there was only a few people in the school who knew about it because I was told to kind of just keep quiet and get over it. But I think it is so painful for me. It's like it goes just all over my body. It starts in my lower abdomen and then it goes down my legs, it goes upwards, it goes to my boobs, it goes like over my shoulders, and I find myself tense, and I get headaches along with it, obviously, because I'm trying to like, don't focus on the pain, and then I'm just kind of stood there in my head almost like blank completely. Just, I need to get through this pain and I'll be fine. And that's every month. And mine last, I would say 10 to 12 days. It's rough. It's just a rough time.
You know those weird adverts though where you've got like women promoting Tampax and they're like rollerblading down the street?
Yes. Rollerblading who?
You can do anything with this product.
One, where she's like, I play tennis, and I'm like, I can't.
That me off because I'm a beluga whale on the floor.
Yes, exactly.
I can do it with morphine, but
yeah, exactly. Give me morphine, I'll be fine.
Yeah.
I can't.
It's just like, I'm Serena Williams. I use Tampax to play like tennis. I'm like, cool, good for you.
But it's like good for you. But like, I'm sat here, I'm like in my sleeping bag, like I can't move. Am I gonna have to tell my friend that I can't go out tomorrow because I'm like a caterpillar? Probably.
And just talking about pain a lot, but the converse to that is pleasure, right? And for me, reproductive health is just as much about the pleasure part and the positive part as, the being unwell and the illness part. But the problem is that whenever you try to introduce pleasure as part of the reproductive health conversation,
it just goes
people on the other side of the spectrum are literally like, why are you talking to young people about pleasure and feeling good about themselves? You're corrupting young minds. Even though there's really rich data that shows, self-pleasure starts really young, actually, from 8 onwards. Some data was presented at a conference. People start having awareness about their body and that like this feels good if I touch it, but people don't want you to have those conversations with young people because they think you're corrupting them. So it's a massive challenge because they're happy for you to talk about the pain and the disorder part, but they don't want you to talk about any of the good things, and then it leads to a really skewed perception as well with healthcare. Like, what can I talk to a doctor about? I can only go and speak to them about, when something's dysfunctional, and I can't speak to them about how I achieve pleasure because, that's not for them. And so they, go on TikTok or watch porn or something to get information because they don't have anywhere else to go.
Because they don't have anywhere else to go, for sure. Okay, I want to talk to you about kind of pain management, but I also don't want to just have the conversation around pain management because I feel like that's doing the thing that we've said we should not do and only talk about it when things are really bad. So like, obviously, what I try and do is open up this conversation around like period well-being, right? Like menstrual care, like this idea that you should and can take care of yourself, like understanding your cycle, knowing when your bleeding days are coming, knowing when some of that discomfort might arise, like what can you do, be that like, I don't even know, sit down and just like have a cup of tea or like take a bath or like be like, I'm just feeling a bit crap, I'm just gonna go spend and watch a movie, right? Like the idea that sometimes we don't really, and we're never encouraged realistically, unless someone's trying to sell us something, to like slow down and just take that well-being thing away from anything else that's product based, right?
Yeah, I definitely am like really big on like tracking my periods and stuff like that. I mean, obviously I know all of these apps sell our data, but I've actually just like, everywhere has my data at this point. Like if the government want me, they know where to find me. It's fine. So like I'm like really big on like period tracking, and like I can be quite inconsistent with it, but I do try for the most part to be like, I'm feeling this way because of this thing, and aligning those things. Obviously, like I use like all of the CBD products and stuff like that. I think like when it comes to like being on my period, like obviously I'm speaking from a privileged position because the pain is not that bad, but I do try to like prioritize some form of exercise because I feel like sometimes
spinning.
Yeah, spin like because if I sit in it, I think I'm like consumed by it more.
Okay.
So it's like, what small things can I do to like kind of keep me going and keep me on track? Like food is also a big thing as well. Like obviously I don't eat dairy anyway, but even if I have a bit of it whilst I'm on my period, it intensifies like the pain I'm already having. So I'm like very conscious about what I'm eating, how much water I'm drinking, and in general like giving myself grace. Like if I'm not feeling it, I'm not feeling it as well. And like for me, I have ADHD, and like one thing about ADHD is like when you're on your period, that ADHD medication is not going to work. It might as well be Tic Tacs. So I feel like when I'm on my period, like my brain is at its most like, no, do you know what I mean? So I really do have to give myself grace, and that's probably one of the best things I do in terms of like well-being, because I just know that it doesn't matter. It's a wrap for me at that time when it comes to thinking critically or like doing things that require brain power.
Yeah, I love that thing you say, like giving yourself grace. And that's always something I try and tell to young people is like, this is like happening to you like all the time. Like it's okay to be like, this just doesn't feel that great. I'm just not having the best day, right? Like it's all right just to feel a little bit unmotivated and a bit like, I don't want to use the word slobbery because that just sounds really like classed and gross. But like if you just want to lay on the couch and do nothing, like that's okay. Whereas sometimes it's like, again, the idea is that if you also want to get out and do a bit of sport, like do your spin class, do tennis, do whatever you want to play, just run around, like that can also be a thing too. Whereas I feel like sometimes we're like consistently trying to give them permission for certain things as opposed to just like what feels good for you is okay. That can be part of your sort of management and well-being for your body. Then sort of on the flip side, that being that there are some people who unfortunately have to rely on medications to get through their period. What does that look like? What's the reality of that?
Yep. So definitely also think that doing the more lifestyle things is really important. So we know there's some evidence that exercise and people that exercise more, menstrual pain can be a bit better. Diet, there's a lot of overlap between irritable bowel syndrome and menstrual pain, particularly endometriosis. About 50% of people have both. So actually altering diet, like Chante mentioned, eating less dairy might actually be a component of that for some people, and actually taking medication type that we call antispasmodic, so stop your bowels like cramping as much, may really help some people, so that you can get over the counter in addition to other pain medication really may well help. So the kind of pain medications that people often start off with are class medication called non-steroidal anti-inflammatory drugs. So that's your ibuprofen.
So this is like over-the-counter stuff?
Over-the-counter, ibuprofen, naproxen. So you can usually get those over-the-counter. Obviously, not every type of medication class is going to work for everybody. Those are the ones that have been shown to, have the most medical evidence. Some people just use paracetamol and it does work for them. There's also codeine, cocodamol, but that can constipate people, so make the bowel symptoms a bit worse.
So we're just in a vicious cycle. Yeah, okay.
Yeah, so that can make a bit of a vicious cycle for some people. Can also make a few people feel drowsy. After that, there's, hormonal medication.
So then this is prescription stuff now?
Yes.
Okay.
So actually now we've got the progesterone-only pill, which is over-the-counter.
Okay,
so you can get the progesterone-only pill over-the-counter.
The Ella1?
No, that's the emergency contraceptive pill.
Ella1 just launched one it's called Hannah.
So yes, it's the same pharmaceutical company, I think, makes another progesterone pill, and one of them's called Hannah. Yeah.
Okay.
So they all kind of have disogestrel and forms of progesterone in them, which can also be used as a contraceptive. But we know those types of hormonal medications can also reduce people's menstrual pain, because some people on them won't have any period. So they might just get occasional cyclical pains. But obviously, with all hormonal medication, people might also get other side effects with that. The common one that people start off with is the combined oral contraceptive pill, and we know that, you know, some people don't get on well with combined oral contraceptive medication, although I will just caveat that by saying that a lot of people don't realise there's, you know, over 30 different preparations of the combined pill. So you're started off on one in the middle with estrogen, progestin of, you know, kind of a middle amount of both. But if you're having certain side effects, you can move on to different types.
So it's normal to sort of be able to say, like, you start with this, but then that might not work for you to go back, right? As opposed to just have to, like, get through it and suffer through all the stuff that goes there. You
if
can
you
still...
have more bloating or you have more acne or something like that, you can be moved to a different type of pill, which has kind of less or more estrogen or a different type of, you know, progesterone to get the balance right for you. So you might respond better to a different one. Often people take that without that, you know, that infamous, I'm not sure if you both know about that, the pill-free week that we were told that we needed initially, because
this in Emma in this period book there's a whole chapter about that, which a couple pages that really talks about the fact that that was just something they made up.
So we don't need a pill-free interval. It was put in there, you know, partly to appease the Catholic Church.
That's what it says, to appease the Pope. I was like, wow.
If you have, you know, period pains, then having a pill-free week where you have a bleed and pain is just nonsensical, because your pain just comes back. You're also more likely to forget to start your pill packet, and if you're sexually active, potentially get pregnant. So you don't need to have that pill-free week, and people can take it continuously, less likely to get the breakthrough pain and any other symptoms as well from that withdrawal bleed. That's something else you can try. And then there's, you know, other longer acting methods of contraception which release progesterone. So people may have heard of the Mirena coil, it's commonly known, releases progesterone. There's now a lower dose version called the Kylena. The Mirena's also got another branded version called the Levocert that releases progesterone, and those are actually medically prescribed and known to help with menstrual pains, pelvic pains, and because they reduce your period. So at a year, about a quarter of people don't have any bleeding at all. With the progesterone releasing, and it also it lightens bleeding, reduces the pain, and for people with endometriosis, that's kind of recommended as a first line intervention, right? But you know, some people are prone to progesterone side effects, so that might not agree with them, and not everyone gets the level of relief they need with the progesterone only coil or intrauterine system. These are just various names that they're known by, but those are the kind of main names. But, you know, they can work really well for somebody. And I'm one of those people that I think we need more interventions, we need more information. I think often we need a combination of things to fix it. I think lifestyle changes, trying to have a system which enables us. I believe in flexible working. I believe that, especially with something where if you have regular menstrual periods or you're not on hormones, for example, you know when your period's coming, roughly, for some people, right? So being able to manage your diary around your cycle and work more when you don't have a period. And I think, you know, given how many people in society have menstrual pain, I think this is something that we have to become more accommodating.
For sure. I've heard of like period consultants, which are like, from what I hear, fairly well paid people that work with like high biz women, people who menstruate, to help them plan their biz calendars around their cycle so that they can have maximum like productivity, creativity, XYZ, which was fascinating to me. But like, apparently that's a thing as well. And I think also to add on to that idea of like that flexibility and that accommodatingness, and I think it isn't also just looking at some of those changes, but like how can we adapt these kind of institutions, be that workplace, be that school, to our bodies, in the sense of it doesn't need to be a day off, but can you take an extra 10 minutes if you need to, just to be like, I just got to get this out of me. I've got to go and grab some water. I just need to go and sit down somewhere comfy, right? Some of those things are there. If you've leaked, right, is there somewhere you can go that doesn't feel like you're humiliated and embarrassed by it, but you can go and clean yourself up and get what you need. So like, what are we also doing so that when you do have your period, that if something does go wrong, it gets a bit difficult, that you feel like I'm in a place that can handle that, as opposed to I need to go and hide this somewhere, or like I just can't show up.
I think something else that we know can improve your pain, potentially during menstrual cycles, is self-pleasure. So there is a little bit of research that shows that frequent orgasms, self-pleasure, or, regular sex where you orgasm can actually improve your menstrual pain to some degree as well. And this is important to mention because we also know there's an orgasm gap, right?
Yep.
So
that's another episode.
And that is, an issue within society. But there's real big benefits to having pleasurable sex or self-pleasure, which we're told is really taboo. We know it can improve pelvic pain, but it also releases endorphins. It can make people happier generally, make people more productive, more creative. So that is also another thing that to factor in if you can do something about it.
Thank you. Excellent 10 out of 10 advice. Okay, last question is, for young people listening, for educators listening, what should you do if you are experiencing period pain at school?
I think, I mean, if I was at school and I was experiencing period pain, I think in hindsight, it's easy for me to now say, I would just say this is how I feel and stuff. But I imagine it's particularly difficult if your schools aren't equipped to have that conversations. If period stigma is still a thing, there's a taboo around taking your pad out and stuff like that. I think there has to be people that you feel comfortable speaking with who can act on behalf of you or advocate for you if you need some sort of support. And I don't know if every single school has that individual or if there's always someone that can be like, okay, cool, this is what we're going to do for you, or this is the space that we have for you. So I guess the most important thing I can say is like being vocal, being honest, and seeing how your peers and also the staff in your network or in your school can actually aid you in all of that. Because I think if you kind of suck it up or you sit in silence or you try to firm it and then you don't kind of deliver to the best that you can, then people start to think, oh, like, what's wrong with this person? Or then people start to feel not necessarily let down by you, but you're not delivering in the way that they know you usually can. And so they become more suspicious than they need to be when actually you're just in a lot of pain. So I honestly think being able to speak about it openly is like one of the most important things. Also your parents as well. Like, tell your parents about what you're experiencing. Let them advocate on behalf of you to your teachers, to your form, to whoever it is, because I'm sure they would if an adult was talking to an adult, I think they're going to take it with a more seriousness than if it was just yourself and if you're nervous about that, I think.
Yeah, for sure. Which is hard, right? Like you say, it's easier said than done because like we've got our like adult brains on us now as opposed to when you're a kid. But if you can and you feel, like I say that to young kids, if you feel like you can say something, you're also helping your other classmates by like opening up that conversation, making teachers understand that this is something that we need to do something about, be very aware of. So if you feel like you can do it, definitely do it.
So sometimes if you're a student that feels more confident or you like doing things within your school, you can potentially embed that within the conversation. Like, what are we doing for students that have reproductive conditions or menstrual pains in terms of making it easier for them to leave the classroom?
Yeah.
And the teacher's not asking loads of questions about where you're going.
Where you're going, what you're doing, who you're going there with.
Yeah. And I think those are things that, schools need to be encouraged to get rid of. So even as a parent, saying, how is my child able to leave the classroom freely in case they're leaking? Or do they need a hall pass that takes like 30 minutes to get, right? Which is not feasible for somebody that is either bleeding heavily or has menstrual pain. They just want a break now. As I said, I was still sneaking products to the toilet.
Yeah.
So, if you're a braver young person, yay for you, because it took me a while to get.
Yeah, being a teenager is hard. Yeah. All the time I was like, I never have to be a teenager ever again in my life, and I'm so happy about that because it's rough.
It is rough.
You're going through a lot.
It is rough. There's a lot going on.
For sure. Amazing. Well, thank you both so much for your time today. It's been a joy to speak to you, and have a great day.
Hi, my name is Annabel, and I started my period when I was 14.
Hi, my name is Chante, and I started my period when I was 13.
Thank you for listening to the Blobcast, where open conversations are our thing. Now, we want you to do the same in everyday life. Tell people that you're on your period, talk about your bleeding, and don't hide your period products. The more you talk, the more shame and stigma can be broken down. And the more that happens, the more we can free the period. We are sponsored by PHS. PHS supplies schools with period products which are free for any and all learners who need them, whenever they need them. No questions asked.
If you're a teacher or a student listening to this, you can find downloadable resources on the PHS website. The link is in our episode description. Don't forget to follow us on our social channels. Just search for the Blobcast.